So what we're going to do today is we're going to look at a model lung. And the model that we're looking at is just a simple model that has a plastic dome that simulates the thoracic cavity, the balloons inside, which are simulating the lungs, and this rubber piece, which is simulating the diaphragm, which is our breathing muscle. And what we're going to do is we are going to actually demonstrate Boyle's law. And Boyle's law indicates that at a constant temperature, that pressure is going to vary inversely with volume. So if we increase the volume in an area, it's going to decrease the pressure. And if we decrease the volume, it's going to increase the pressure. So notice that as volume changes, pressure also changes. So the way that inhalation, exhalation work, or inspiration, expiration work, is it's based on pressure changes. And we're looking at pressure around the body, which is atmospheric pressure, and pressure inside the thoracic cavity and inside the lungs. So the pressure inside the lungs is the intrapulmonary pressure. So what happens when we pull down on the diaphragm? As we pull down on the diaphragm, notice that the balloon's inflated. As we push up on the diaphragm, notice that the balloons are deflating. And the reason that's occurring is because of the change in volume and pressure. So one thing to note is that pressure gradients work very similar to concentration gradients. Pressure is going to go from higher pressure to lower pressure. So when we inhale, what's happening is our diaphragm is pulling down. As we pull down on the diaphragm, what's happening to the volume in the lungs as well as in the thoracic cavity? That intrapulmonary volume, the volume inside the lungs, is actually increasing. And remember that as a volume increases, the pressure decreases. So now we have a decreased pressure inside of the lungs and an increased pressure around the lungs. So air is going to move from around the lungs to into the lungs where there's less pressure, and that's going to cause our lungs to inflate, which is what's happening during inspiration. In expiration, as the diaphragm recoils, it pushes back up. So as we push back up, what are we doing to the volume of the lungs and to the thoracic cavity? We're actually decreasing the volume in the thoracic cavity, which decreases the intrapulmonary volume, which is the volume inside the lungs. So remember, now that we decreased the volume, what's happening to pressure inside the lungs? It's increasing. So as that pressure increases, we now have a lot of pressure in the lungs and less pressure around the lungs. So that's going to cause the air to move from the lungs out. So again, as we inhale, we increase the volume, decrease the pressure, so air moves in. And as we exhale, we decrease the volume, which increases the pressure, which causes air to flow out of the lungs.